Hi, my name is Allison Cornelius. I'm a USA nursing student and I'll be performing the central venous access dressing change for you today. So here's my ID and scan the room. So the first thing I'm going to do is verify my order and verify hospital policy. Then I will gather all my equipment and perform hand hygiene. Then I will identify my patient with two identifiers. So I have Jaguar J. Jones, date of birth 8/25/1963, and MR number 4176352. And I see the allergies are penicillin. I also see that on the bracelet. Then I'll explain the procedure to my patient and provide privacy. Then I will perform hand hygiene and assess the site. So I'm looking, inspecting, and I'm going to palpate lightly on top of the dressing. So I'm looking for any abnormalities like edema or erythema. So then I'm going to position my bedside table and position my trash can and perform hand hygiene. I want to note right now that I'm working below the waist level. In a hospital setting, I'd be working above the waist level. So now I'm going to raise the bed, lower the side rails, make sure my patient is comfortable with their face facing away from me and their head elevated slightly. Then I'm going to open my package and throw this away. I'm going to open it away from me, only touching the 1-inch border, just touching that, and then I'm going to place my mask on and my goggles. Then I'm going to place this mask on my patient. So I'm just going to place it right here. Then I'm going to put on my clean gloves. Okay. Now I'm going to begin removing the dressing. So I'm going to remove it towards the center. Moving it towards the center to not keep the dressing intact, to keep the catheter intact, sorry. Okay. Now that I've removed that, I'm also going to remove the bio patch with it. And I'm going to assess the insertion site, the catheter itself, and the surrounding skin. I'm looking for any signs and symptoms of any complications. And then right now, if I were to take a culture of the drainage, I would do it now. So now I'm going to dispose, going glove to glove and skin to skin. I'm going to throw that away. Perform hand hygiene. I'm going to begin opening my package. So I'm opening this by only touching the 1-inch border. Okay. Then I'm going to put on my sterile gloves. Only touching the 1-inch border again. Making sure this lays out good so I can put them on easily. Okay. I'll put on the sterile gloves. Okay, now that I can touch glove to glove, I'm going to arrange my contents on my sterile field. Being careful of the 1-inch border. Let me get this on top. Okay, so the first thing I'm going to do is clean with my alcohol swab. So I'm going to open that. discard, and discard. I'm going to be cleaning this. I'm going to grab the catheter, and now this hand will be contaminated to stabilize it. So I'm going to be wiping in circular motions. Can you get closer for me, please, to show this? I'm going to be wiping in circular motions. Careful not to go over the same area twice. Okay, I'm going to throw that away. Then I'm going to grab my ChloroPrep and activate it. And I'm going to wipe horizontally and vertically. Really vigorously. I'm also going to wipe the catheter itself on the top and the bottom. I would do this normally for 30 seconds. I'm going to throw that away. And I would normally let it dry completely before I continue, but since this is a video, I'm going to just continue. So I would normally let it dry completely before I do anything else. So I'm going to grab my bio patch and place it with the blue side facing up. Now I can let that go, and I'm going to grab my Tegaderm. I'm going to place this carefully. I'm going to make sure it's smooth. Now I'm going to begin taking this off, keeping my label intact so I can put the label back on it in a minute. I'm following it so it stays on. Okay, I'm just gonna set that right there. So then I'm gonna take off my gloves, glove to glove, and skin to skin. Throw that away before hand hygiene. Take off my mask. Take off my patient's mask. Then I'm going to grab this label. And I would write the date, the time, and my initials and place it on the edge. Then I would lower the bed, raise the side rails, make sure my patient is comfortable, and get rid of, and within the call within reach of the call light. Then I will throw away all my equipment and perform hand hygiene. Then I would document the appearance of the site, the amount, characteristics, and if I took a culture or not on the drainage, the cleanser I used to clean it, the type of dressing I used, how the patient tolerated the procedure, the date, time, and my signature.